Understanding hypertension today will break down the basics of blood pressure, what systolic and diastolic values mean, why they matter, and how we manage them in the clinical setting. Systolic blood pressure, SBP, maximum pressure during heart contraction. Systolic blood pressure, or SBP, is the maximum pressure exerted on the arterial walls when the heart contracts, known as systole. Diastolic blood pressure, or DBP, is the minimum pressure in the arteries when the heart is at rest, or during diastole. Epidemiology of hypertension. Hypertension is a major public health issue, affecting approximately 70 million Americans and 1 billion people worldwide. It is a significant risk factor for myocardial infarction, stroke, heart failure, atrial fibrillation, aortic dissection, and peripheral arterial disease. Globally, around 62% of strokes and 49% of coronary heart disease, CHD, cases are attributed to suboptimal blood pressure, contributing to more than 7 million deaths annually. A study estimated that 14% of deaths and 6% of disability-adjusted life years, DALYs, lost globally are caused by non-optimal blood pressure levels. Although hypertension is typically defined as a systolic blood pressure higher than 140 mmHg, over half of the attributable cardiovascular disease, CVD, burden occurs in individuals with systolic blood pressure below 145 mmHg. In the United States, the prevalence of hypertension increases with age, rising significantly after age 30. After menopause, the prevalence increases rapidly in women, surpassing that of men. By age 75, nearly 90% of individuals will have hypertension. Racial and geographic disparities in hypertension. Racial disparities exist in hypertension prevalence in the U.S. Over 40% of Black Americans have hypertension compared to 25% of white and Hispanic Americans. Hypertension in Black Americans tends to start at a younger age, be more severe, and cause more target organ damage, leading to greater premature disability and death. The third National Health and Nutrition Examination Survey, NHANES-3, revealed that hypertension affects at least 33 million white individuals, nearly 6 million Black individuals, and 1.3 million Hispanic individuals. In Black individuals, the hypertension rate is approximately 40%, among the highest globally. Global hypertension trends. Globally, close to 1 billion adults have hypertension, with 333 million in developed countries and 639 million in developing countries. This number is projected to exceed 1.5 billion by 2025. Hypertension leads to 7.6 million premature deaths annually, with 80% of these deaths occurring in low and middle-income countries. The global burden of hypertension is increasing due to rising obesity rates and longer life expectancies. Intriguing insights into hypertension. Hypertension is often called the silent killer because it can remain asymptomatic for years. Regular blood pressure checks are crucial for early detection and management, especially as you age. The white coat effect. Some people experience elevated blood pressure readings in clinical settings due to stress, known as white coat hypertension. While less risky than consistent hypertension, it highlights the impact of situational stress. Global burden. The global impact of hypertension is staggering. Affecting 1 billion adults, this number is projected to rise to 1.5 billion by 2025, with 80% of related premature deaths occurring in low and middle-income countries. The salt connection. In Finland, a 30-year campaign to reduce salt intake by 1/3 led to significant reductions in blood pressure and a remarkable 75% decrease in deaths from coronary artery disease and stroke. Exercise paradox. Regular exercise generally lowers blood pressure, but in people with hypertension, it can provoke an exaggerated hypertensive response. Tailoring exercise to individual needs is important. Blood pressure. Variability. Blood pressure naturally fluctuates throughout the day, and even small reductions of 4 to 5 mmHg can result in significant reductions in stroke and cardiovascular risk, especially in high-risk groups. Beyond just numbers. It's important not to focus solely on achieving a specific blood pressure target. Reducing blood pressure overall, regardless of the exact target, is more important for reducing cardiovascular risk. Clinical significance of blood pressure. Blood pressure is a crucial sign of cardiovascular health. Elevated blood pressure, or hypertension, is a leading risk factor for cardiovascular diseases, such as coronary artery disease, stroke, heart failure, and kidney disease. Even small increases raise cardiovascular risk. There's a linear relationship between blood pressure and the risk of vascular mortality. Systolic blood pressure, a key predictor of cardiovascular risk. In older adults, systolic blood pressure is a stronger predictor of cardiovascular risk than diastolic pressure. Isolated systolic hypertension, or ISH, is common as arteries lose elasticity with age. Pulse pressure, a measure of arterial elasticity. Pulse pressure, the difference between systolic and diastolic pressure, is also a critical indicator of cardiovascular risk, especially in conditions like heart failure. Accurate blood pressure measurement is key. Accurate blood pressure measurement is essential for diagnosing and managing hypertension. Patients should be seated comfortably, with their upper arm at heart level and legs uncrossed. Proper cuff size ensures accuracy. The cuff size must be appropriate, with a length and width of 80% and 40% of the arm's circumference, respectively. The first sound marks systolic pressure, and the last sound marks diastolic pressure. Causes of hypertension: an intricate interplay of factors. Hypertension is a major global health concern and results from a complex interplay of genetic, environmental, and lifestyle factors. Primary hypertension, primary or essential hypertension, accounts for 90 to 95% of cases and has no identifiable underlying cause, making its pathogenesis multifactorial and complex. Genetic factors play a significant role. Familial clustering of hypertension and genetic studies show that genes affecting renal sodium resorption, endogenous pressure production, and smooth muscle cell growth contribute to high blood pressure. Environmental factors modulate genetic susceptibility. 1. High dietary sodium intake is strongly associated with hypertension. 2. Obesity contributes through sympathetic nervous system activation and insulin resistance. 3. Stress, smoking, physical inactivity, and limited healthcare access further exacerbate hypertension risk. Renal sodium handling plays a key role. Reduced renal sodium excretion leads to fluid volume expansion, increased cardiac output, and elevated blood pressure. Vascular resistance increases due to vasoconstriction or structural changes in vessel walls, contributing to the development of hypertension. Secondary hypertension. Secondary hypertension, accounting for 5 to 10% of cases, arises from identifiable underlying causes, offering the potential for cure with treatment. Common causes include: 1. Renal parenchymal disease, the most common cause of secondary hypertension, often stemming from chronic kidney disease. 2. Renal artery stenosis, narrowing of the renal arteries, typically due to atherosclerosis or fibromuscular dysplasia. 3. Adrenal disorders, conditions like primary aldosteronism, Cushing syndrome, and pheochromocytoma. 4. Coarctation of the aorta, congenital narrowing of the aorta. 5. Obstructive sleep apnea. Sympathetic nervous system activation during sleep apnea episodes raises blood pressure. 6. Hormonal disturbances. Conditions like acromegaly, hypothyroidism, and hyperparathyroidism. 7. Medications. Drugs like oral contraceptives, NSAIDs, decongestants, and immunosuppressants. 8. Drug use. Illicit substances like cocaine and methamphetamine can cause dangerous spikes in blood pressure. Medications. Useful in hypertension. A comprehensive overview. Diuretics. Thiazide diuretics are often the first-line choice for most hypertensive individuals, especially older adults and Black patients. They inhibit sodium reabsorption in the kidneys, reducing blood volume. Chlorthalidone is particularly effective in reducing cardiovascular morbidity and mortality. Loop diuretics are more potent, useful in patients with renal insufficiency or resistant hypertension. Examples include furosemide, torsemide, and bumetanide. Potassium-sparing diuretics reduce potassium loss when used with other diuretics. Spironolactone and eplerenone, aldosterone antagonists, may also help prevent myocardial fibrosis and reduce mortality in heart failure patients. Adrenergic inhibitors, beta blockers, block the effects of adrenaline on the heart, reducing heart rate and contractility. They are useful in patients with coronary artery disease, heart failure, and tachyarrhythmias. though they are less effective as monotherapy in Black patients. Alpha blockers relax blood vessels by blocking alpha adrenergic receptors, reducing peripheral resistance. They are particularly useful in patients with prostatism due to their effect on smooth muscle in the prostate. Renin-angiotensin system, RAS. Inhibitors, ACE. Inhibitors block the conversion of angiotensin I to angiotensin II, reducing vasoconstriction. Effective in patients with heart failure, coronary artery disease, and nephropathy, but less effective in Black patients as monotherapy. ARBs block angiotensin II from binding to its receptors. They offer similar benefits as ACE inhibitors and are an alternative when ACE inhibitors cause a persistent cough. DRIs inhibit renin, the enzyme that initiates the RAS cascade. Aliskiren is currently the only available DRI, though its long-term effects are still being studied.
Calcium channel blockers, CCBs. CCBs inhibit calcium influx into vascular smooth muscle cells, causing vasodilation and lowering blood pressure.
Dihydropyridine CCBs like amlodipine act on peripheral blood vessels, while non-dihydropyridine CCBs like verapamil also affect heart rate and contractility. Direct vasodilators hydralazine relaxes vascular smooth muscle, reducing peripheral resistance. It is often used in severe hypertension. Minoxidil is a potent vasodilator reserved for refractory hypertension due to potential side effects like hair growth. Key considerations for antihypertensive therapy. The choice of medication should be individualized based on factors like age, race, and comorbidities. Combination therapy is often necessary to achieve adequate blood pressure control. Regular monitoring and follow-up are crucial to optimizing treatment. Managing blood pressure in clinical settings. Managing blood pressure in acute settings requires precision. In heart failure, blood pressure must be carefully controlled. In patients with diabetes, tight blood pressure control reduces the risk of complications. Key takeaways: SBP and DBP are critical markers of cardiovascular health. Accurate measurement is essential for managing hypertension. Remember, systolic and diastolic blood pressures are essential markers of cardiovascular health. Accurate measurements and proper management are crucial for reducing cardiovascular risk. If you found this video helpful, give us a like, subscribe to our channel for more medical insights, and leave a comment with your questions.